Hi, Brenda with the Care Plan. I'm going to talk a little more detail about nail and foot care. As I said in the introduction, that it's really a great way to get to know your patients, offer truly a service that they need, and it creates trust, and it just exemplifies that care is to treatment. And by looking at somebody's feet especially, you can see kind of what the condition of their care has been, their body, how things, how much attention they've had. So what I usually do is on a mission, or when I first meet them, I say, let's have a look at your nails and see how they're doing, part of my assessment. And they get the sense that I'm being thorough, and I am. And I'll say, well, it looks like they could use some attention. And so we're gonna get to those feet, and maybe not today, but next week, and we'll schedule a time. And time is of the essence, right? So sometimes if I have some more time, I will soak their feet before. If I don't, I don't. And if they're in bed, sometimes I'll just put a waterproof pad down, cover their feet with a really warm, wet washcloth, and let that be the soaking. And sometimes that's good enough, and it feels great. And I have I keep this in my nursing kit. It's just a really good, heavy-duty professional nail kit with 3 different kinds of trimmers and things to go around the cuticles, clean underneath. And it often takes more than one go. I'll do a little bit and go back at it another couple of weeks. I usually keep a set of, this is a permanent one, which I don't use. I use disposable emery boards that I just leave at the home, my gloves, a pad that's not gonna contain all the nails, and a really good cleaning set. I keep my set extremely clean. I use 2 or 3 of these each time I do, and I always wear gloves. And then even if it's brief, I always give a bit of a rub down. And there's lots of different creams, barrier creams. Just use whatever you have or what they have in their home or at their bedside. I keep a couple in my nursing bag with me at all times. So I really focus on the feet. And again, it's a nice, safe distance. I pull up a stool or a chair, get them comfortable, and I'm reading the patient the whole time. It's a great time to ask questions. Tell me what's going on with you. How does it work? I find that people are a little resistant and not as open to symptom management. Once you give them a little mini pedicure, they're like, oh, I'm a little bit more open. Also, massaging the hands. I sometimes, before starting nail care, if I'm just trying to gain some trust, some familiarity, say with a dementia patient, I just pull out a little cream, and I just sit there very gently massaging their hands while I'm sitting next to them, asking questions, and then, depending on their needs for fingernail care, which is often the case. So there's a lot of right ways to do this. My advice is plunge in, find your way, use good equipment, keep it extremely clean, wear your gloves, use a barrier, and give it a try. A lot of people say, well, that's what our home health aide does. Our aides are extremely busy, and a lot of the caregivers in facilities and homes, often patients are diabetic or they're on a blood thinner, and home health aides generally can't do the nail care, or caregivers can't do the nail care if that's the case. And personally for me, I like to have that in my practice with my patients, and it seems like it takes more time, but it saves you a lot of time by just building that trust. So plunge in there, good luck, and give it a try.